Today we will discuss the bleaching procedures, the etiology of the discoloration, and the types of bleaching, its mechanism, and how it is applied, its contradictions, and its sustainability. For the etiology, it can be genetic, defined with amelogenesis imperfecta or odontogenic imperfecta that affects the bones and becomes brittle. In these cases, bleaching is not indicated and we go to more comprehensive restorative treatment. Even though these restorative treatments are difficult due to the compromised tooth structure. Other systemic disease like the thalassemia and the sickle cell anemia can also make a defect in the skull or the long bones. Also, we can see that some intrinsic discoloration can happen in the sickle cell anemia, where blue, green, or brown discoloration can be present. Some vitamin and mineral deficiencies can also make an anomalies in the bone, especially the vitamin D. Tetracycline discoloration is one of the most common drug-related causes. It can happen in the uterus stage, or it can happen until the age of 8. This material can be embedded inside the enamel and dentine in the phase of their development. Usually the walking bleach, which is the internal bleaching, is sufficient to get an effective result, but in this case we need to do an endodontic treatment. So another procedure with doing an external bleaching can give us good results. In severe cases, we can do full crowns. One of the other local intrinsic causes is the trauma, where an intrapulpal blood vessel become hemorrhaged, and it gets inside the dentinal tubules, which will cause a brownish and reddish discoloration. If the pulp survives, the color returns to its initial shade, but if it became necrotic, the discoloration is maintained, and we should do the intracoronal bleaching, the walking bleach. We must make sure when we do the endodontic treatment that no pulp remnants is present. This is a case of a discoloration that happened after an endodontic treatment. After we did the non-surgical retreatment with a proper endo filling of the canal, then we started the internal bleaching, and we can see the results are so acceptable, matching the shades of the adjacent tooth. The calcification of the coronal pulp due to the tertiary dentin accumulation will make the teeth appear more yellowish. In these cases, the bleaching procedures will not render any positive results, so veneers or full crown coverage will be indicated in the severe situations. The external causes are common, like the food, beverage, smoking, that can be solved using scaling, polishing, and bleaching. A side note, before we do an orthodontic application of the brackets, there should not be any bleaching procedure to avoid any bonding deficiency. So we should wait between 2 to 3 weeks before we apply the bond and the resin composite to the tooth structure. Now let's discuss the chemistry of bleaching, the mechanism. How does it happen? It happens due to the alteration of the optic properties of the pigment molecule, where an oxidation happens and breaks down the bonds of the big molecule of the pigment. So its light absorbing and reflecting properties is altered, resulting in a more white appearance. And what is responsible for this action is the peroxide compound and the oxygen radicals that are so reactive and do this oxidation process. So this compound, the hydrogen peroxide, is a reactive, colorless liquid and more viscosity, has a more viscosity than water. If we want to accelerate this chemical reaction, we can increase the temperature of this compound. It can be used in at-home concentration for home bleaching with a concentration of 3 to maximum 8%, but inside the office we can use it in concentration between 25 to 38%. It is important to note that this reaction does not affect the hardness of the enamel nor the inorganic molecules inside the dentine, but we have seen that some oxidation happens in the organic matrix of the teeth. The carbamide peroxide is a bleaching agent that contains the hydrogen peroxide in its composition, but it is more safe, so it is usually used as a home bleach product. In some cases, we can use it as an internal bleach compound. It is also slower in its reaction in comparison to the hydrogen peroxide, so it requires more prolonged time of application that can be for several hours to take the appropriate result. As for the sodium berberate, it comes as a dry powder or a gel because it is safer to work with in comparison with the hydrogen peroxide, so it is so popular in the intracoronal bleaching or the walking bleach. Some rebonding can happen of the pigments molecules, and we may have a discoloration again, but it is subjected to the duration and to many other circumstances. Now let's discuss the walking bleach technique. First, we must empty the pulp chamber and the beginning of the root from any filling, and then make sure that no remnants is inside the canal. So we use xylol or hypochlorite to clean the chamber really well. After that, we apply a 2 mm barrier layer of glass ionomer to make sure that no leakage of the bleaching agent reaches to the apical area. After that, we mix the sodium barbiturate with distilled water or with the anesthesia solution until we reach a wet sand consistency, and we apply it over the barrier. Then we use a cotton palette and dab it gently on the bleaching agent to decrease the moisture a bit, and we close the tooth with a temporary filling. After 3 days, from 3 to 10 days, we should re-see the patient and evaluate the process, and we can repeat it for 4 to 3 times until we reach the desired color. After reaching the desired color, we should wait for 1 to 3 weeks before we apply the finish restorative material, because this material affects the bonding and the polymerization of the raising cement. If you did not see any improvement after 3 to 4 attempts, we should reevaluate the treatment plan and see if there is any other procedures that can be done. This is a case where they applied. Here is the barrier, as we said. This is the agent and the temporary filling, and we got a very nice end result. Another case here. As we said that if we did not use sodium barbiturate, we can use instead of it the hydrogen peroxide with a concentration of 30 to 35%, and we can increase its activation by using heat, a direct heat, whether it is with a system B or any other heat device that is available in the clinic. This application of heat will cause a foam in the hydrogen peroxide because there is a release of the free radical oxygen, and it is repeated for 3 to 4 visits with the application of a temporary filling and the other steps that we mentioned before. But there is a high risk of cervical root resorption when we use this procedure, so the walking bleach using sodium barbiturate is way more safe, and it is more favorable today. Even though if there is any circumstances that made us use this fast method of the heating the hydrogen peroxide, the patient must be informed that there is a risk of a development of the cervical resorption. Another way to increase the result is using a lighter shade of the composite when we do the permanent filling. We apply 80% alcohol to decrease the surface tension, and we use a sodium hypochlorite to dissolve the remnants of the peroxide. We can do the restoration after 1 week, but 3 weeks is the optimum time for the final restoration. As for the external bleaching, it is applied in the office, and the activation of the hydrogen peroxide is now applied by the light sources, the heat of a light source, whether it is an ultraviolet or an LED or the laser light. The LED requires 15 to 20 minutes and it is repeated 3 times. As for the laser, it has a gel that is prepared for the laser activation, which contains a fumed silica and a blue dye that absorbs the laser wavelength, leading to an increase in the in temperature. This makes this method so efficient and time favorable, where each tooth only requires 30 seconds of laser application. Combining the two methods, the home bleach and the laser or office bleach, will give us the most optimum results, and they will give us also the long-term results. As we said, the at-home bleaching requires a trace that a carbamide peroxide is applied in a gel form with a small amount, and it is weared whether at night or in day for several hours, and it is repeated until we get the results that we want. Home bleaching can remain stable for 1 to 10 years of application. Now let's discuss the cautions or the risks of the application of these bleaching agents. The most common is the cervical resorption, and its mechanism is that the free oxygen radicals break down the constituents of the connective tissue, especially the collagen and the hyaluronic acid, which make a periodontal tissue destruction and a root resorption. The treatment of cervical resorption can be as simple as a filling and to the severe reaching extraction. We expose the defect surgically, and we remove the granulated tissue that is the inflammation happened on the cementum, and then we do a curettage using 90% of trichloroacetic acid to remove any remnants tissue before we use the adhesive restoration. This is the treatment management of the cervical resorption. Also, the application of the vitamin E that is known to be a very fast and efficient antioxidant to reverse the oxidation process that is happening due to the free radicals of the oxygen, therefore minimizing the damage of the soft tissue. The question is, does applying the bleaching procedure alters the hardness of the enamel? The answer is no. It causes a micromorphology change, but it has no effect on its hardness. So it is considered safe when applied in the right way using the appropriate material. However, it modifies the organic compound of the dentin. But these changes are not permanent. When viewed under the microscope, we see that there is an increased porosity with a slight erosion. But overall, it is not considered as a change that will make a significant damage or a change to the enamel or dentin structure. So there is no significant clinical evidence of negative effects on enamel by using the bleaching techniques that we have seen. Finally, let's discuss the prognosis of the bleach. They have seen that 80% of successful maintenance of the bleaching results after 1 year, but after 6 years, this percentage decreased to 45%. So, external bleaching may show color regressions after 1 to 3 years. As a final note, well-sealing composite restorations are recommended to prevent renewed discoloration. So, as a result, a bleaching is considered safe when applied carefully and in the right way, with the right concentration and the right duration, and the informing the patient that discoloration may happen, and it ranges from 1 year to 10 years of period of time. The combination of the external bleaching in office and the home bleaching will give us the optimum results, and the internal bleach can save a lot of teeth from going under restorative treatment that is not necessary. Uh, that's it. Salam.